Fibromyalgia. Fibromyalgia is described as widespread pain now and before the 1970s. This syndrome was thought to affect fibrous tissues over the muscles, and this is in turn was the cause of the pain. This syndrome is known to be the most common in women, and it can affect people more as they age. The topic of today will be about the history of fibromyalgia, diagnosis, pathophysiology, some epidemiology, fibromyalgia, comparison with CFS, and treatments. So, some history. Firstly, fibromyalgia is a syndrome, meaning that it has two or more complex symptoms of a specific condition in which the direct cause of pain in the body is not fully understood. This was not known until the 19th century, and around 1763, so let's go all the way back, a French physician once named this syndrome sorry. He once named this syndrome muscular rheumatism. There it goes. Rheumatism is described as chronic joint pains, which are pains that persist a very long time. The way this French physician described it as pain in the fleshy parts without fever. In 1904, fibromyalgia was once called fibrositis. It was thought it was the inflammation of tissues. And in the 1970s, the concept of the name fibrositis and the symptoms was actually generalized into the public. This includes the symptoms such as sleep disorders, tender points, depression, fatigue, and mood disturbances. By 1990, the idea of multiple tender points in the syndrome was used as a way to diagnose the patients, but not all had to perform the complex tender point examination. The accuracy in clarifying the syndrome was only 65.9% at the time with just examinations alone, with the thought of it just causing widespread pain. Also, at the time, American College of Rheumatology issued the recommendation for calling the name fibromyalgia, since they noticed in muscle biopsy that no inflammation was present in the muscle. Around 2010, though, some colleges abandoned the diagnostic test on tender points, and is now based on number of painful body regions, the presence and severity of fatigue, unfreshly cognitive difficulty, and the extent of somatic symptoms. Secondly, the very definition of fibromyalgia actually caused the confusion in diagnosis. And this leads to diagnosis, of course, where some will use the 1990 pressure points or the new 2010 criteria of fibromyalgia. It is now defined as the presence of both history of widespread pain, such as pain on the left, on the right of the body, above and below the waist. There's my waist, not up here. And usually with axial pain. During a physical examination, the examination of the palpitation points of 11 to 18 specific regions on the body, the physical examination is determined by the application of 4-kilogram weights of force, which is around 8 pounds. If in fact the pressure would cause points or tenderness in the muscle, testing of diagnostic imaging helps to rule out other painful cases. The diagnosis of fibromyalgia still lacks more depth into the know-hows of diagnostic testing, but has continued to improve throughout the years. And here, as we can see, the 1990 pressure points, the palpitation points, the 8 pounds applied to the muscles during physical examination, the 2010 criteria, and still lacking more depth. So it leads into our next slide. Thirdly, to understand the pathophysiology of the syndrome, as stated earlier, the core of widespread muscle pain and tenderness. It's understood by author trainer in his article Pharmacotherapy of Fibromyalgia. Defects are in the ascending pain pathways and the descending inhibitory pathways. Let's say um, these ascending pain pathways actually transmit signals from the peripheral nervous system to the brain. The peripheral, also known as the PNS, is part of the nervous system. The PNS is subdivided into sensory and motor divisions. The division most important here is the motor division, also known as the afferent division, which is the part that conducts impulses from the CNS to the effectors. The effectors that will be mentioned will be part of the somatic nervous systems, which are the voluntary movement of skin, joint, and most important, skeletal muscle. These impulses are conducted from the CNS to the somatic nervous system. So when one feels pain, let's say they get a scratch on the skin, that the pain receptors are triggered and send signals to the PNS. From the signals are transmitted to the spinal cord, which is part of the CNS where the microglia cells are present. These glial cells maintain a healthy CNS, central nervous system. Excuse me. They can touch and monitor the neurons that send signals. It also tends to migrate towards injured neurons and can change to get rid of microorganisms and neural debris from the central nervous system. Of course, this is all traveling to the brain and back. So that was a little information of like anatomy wise, but now more into the physiology wise detailed. Furthermore, in normal circumstances, the localizing pains, such as a scratch or skin joint injury from the peripheral to the brain, comes from the nociceptive signaling traveling from the AS or C fiber neurons through synapses in the dorsal horn of the spinal cord and up and down the spinal thalamic tract to the brain. These signals activate lateral thalamus, cingulate gyrus, and limbic cortex. So the lateral thalamus function is the relay part of the body where it filters information between the body and the brain. The function of the cingulate gyrus is to help regulate the emotion in the body, while the limbic cortex takes care of the fight or flight responses. And these responses, fight or flight response, which is the sympathetic, and the rest of digest, which is the parasympathetic actions of the body. In a patient with fibrosis, fibromyalgia, the abnormal ascending pathways where the nociceptive signals become more active through damage or repeated activation of the neuron which send the signals. It is also thought that that microglial cells that are near the nerve cell axon and facilitate these signals can become pathophysiological. Pathologically, they can become bad. Activated and facilitated these signals from the neuron to the neuron, causing the painful sensations, which causes the pain in areas that are perceived to have pain, but are actually not directly stimulated at all. So here you have the ascending pathway. So normal, as you can see, this is a skin injury, and that's all. And the abnormal, which you see here, and now to the descending. So go descending. So moreover, the descending inhibitory neurons normally help slow down the pain caused by nociceptive stimuli from nearby neurons. These neurons are activated by perception of pain from a localized area and suppress other pains in the body. These neuron pathways start with the periaqueductal gray matter, which is the primary control center of the descending pain modulation, and the nucleus raphe magnus, which releases the hormones that help inhibit pain. They release the serotonin and norepinephrine to the stimulated interneurons by diffusing through the spinal cord, which will then inhibit the nociceptive neurons. With patients with fibromyalgia, though, These inhibitory pathways have been found to be less active because of the idea of fibromyalgia causing widespread pain appears. Since the inhibitory factor does not work, it will cause the widespread pain um, through the pathophysiology. Makes sense in the pathophysiology model. It still has limitations since there are no known reasons how these abnormalities come from. So, like in the neural pathways, um, this explanation also does not give the origin of the symptoms arising from having fibromyalgia that you see, which is depression, anxiety, cognitive dysfunction, insomnia, and other previously mentioned, also the microglial cells and the other factors involved. So this was the normal inhibitory neurons slow down the pain caused by nociceptors. Abnormal, the inhibitory pathways less active, causing the widespread pain. And moving on to epidemiology. Next, epidemiology of fibrosis. The general population in the U.S. as of 2011, it was recorded that it was only 2% of the population who had fibromyalgia. Before women, they are 7 times more likely to have fibromyalgia than men, though fibromyalgia is present in all ages or ethnic groups and it's more common to have it with age. So age is more likely to get it. Fibromyalgia patients also have additional rheumatic diseases or syndromes such as C. infections, HIV, chronic fatigue syndromes, irritable bowel syndrome, and other systemic illnesses. Fibromyalgia will most likely be diagnosed by rheumatologists and then by family physicians. In fibromyalgia patients, the study done by pharmacotherapy of fibromyalgia states that 25 to 80% indirect and direct non-medical costs add up to this percentage. As they said, fibromyalgia extends well beyond the direct medical costs. They were able to measure these costs from other literature writings by one, comparison of the costs with people who had fibromyalgia and a control group of people without the syndrome. And number two, the comparison of the cost of people who were recently diagnosed with fibromyalgia, before and after costs. And what they came up with was with one, on average, 11% was spent on total health care of fibromyalgia. And these are pain-related medications in comparison to average healthcare costs before and after diagnosis have yielded uncertain, conflicting results. So they can't tell between the before and after of the diagnosis of fibromyalgia. Does that make a difference? Some say that healthcare costs increase a mere 30% from just the diagnosis of fibromyalgia, though this percentage only matters if the medical faculty was using diagnostic testings on their patients, yet there may not be patients that even have to take the diagnostic testings, and thus lowers the cost of healthcare. Moving on, as mentioned, fibromyalgia is often with other complicated diseases and syndromes. The one that seemed most intriguing was the chronic fatigue syndrome, CFS. Now, this syndrome sometimes meets the criteria for patients with fibromyalgia. Alone at 43 to 70%, its symptoms are sore throat, new onset headaches, tender cervical axillary lymph nodes, muscle pain, multi-joint pains, unrefreshed sleep, and PEM, which is a worsening of the symptoms they experience. As you can see, there is a clear overlap between these two syndromes in scientific evidence noted by the Ishman et al. In their report that these similarities are found due to common pathophysiological mechanisms of the central sensations. These sensations are usually due to the enhancement response of the central neurons to the nociceptive stimuli. The only main difference to tell CFS apart from fibromyalgia is that it's more often reported that CFS has a slower response speed. Both of these syndromes are similar in comparison, and both need more extensive researching in defining the syndrome in order to understand these definitions. Now, I don't, obviously don't have a slide for that. So, moving on. Anyways, treatments of fibromyalgia in the US. Anyways, treatments of fibromyalgia in the US reported in 2016 is that the Food and Drug Administration has approved 3 drugs in the help of treating fibromyalgia. These are Dexelton and milsapine and pregabalin. Uh, pregabalin. Both duxetin and melanzapine are serotonin norepinephrine reuptake inhibitors, and pregabalin is an anticonvulsant. The reuptake inhibitors cause analogistic properties, which arise from effects on the descending inhibitory pathways in the spinal cord, and the anticonvulsant is thought to reduce the release of neurotransmitters involved in pain processes. What pregabalin does, it reduces the pain by 30% and helps with those with fatigue and sleep and problems. Though the effects of the drug are sedation, weight gain, and dizziness, and just wait just a sec. You can see them now. Sleep and dizziness. So actin helps to greatly reduce 30% of the pain, which can help sleep and function, though the effects are palpitation, headache, fatigue, tachycardia, which is an irregular heartbeat or fast heartbeat, and hypertension. Lastly, milnacaprin can only slightly help the pain, though it is more commonly used for fatigue and memory problems, though the effects are nausea, palpitations, headaches, fatigue, tachycardia, and hypertension. None of the drugs get rid of all the symptoms, as you can see, and most people have looked into the thought of yoga or relaxation workouts in helping minimize the pains, which there aren't many studies of this idea, but hopefully there will be some soon. And as you can see, here was things about what I said. I think it's easier to read it from here. See. In short, fibromyalgia is a complete syndrome with 1 or 2 symptoms. Fibromyalgia is often times with other rheumatic diseases such as CFS, which is very similar to fibromyalgia and can oftentimes be confused for being fibromyalgia syndrome. In the 19th century, the information on the syndrome grew to what it is today, thanks to them. And fibromyalgia is usually has to do with the ascending pain pathways and the descending inhibitory pathways. It is oftentimes more likely for women to get rid of the syndrome than men, and can increase the likelihood to develop over age. And here's some excited for you guys. That's it for today.